Nikki Eining has been helping people with their mental health for 15 years, and the COVID-19 pandemic has brought some new challenges.
The last 18 months have brought stressors that have created a lot of uncertainty, unpredictability, and a need to practice radical acceptance. And when we talk about radical acceptance, we try to really focus on something that's out of my control. So a pandemic, a global pandemic that I cannot control, has occurred and is continuing to occur in some capacity.
Eining says people must recognize parts of their lives that are in their control.
And that might look different for everybody, depending upon the needs for my family, the needs for myself, the needs for my loved ones around me. And so how do I best care for myself and for my family members or friends with the best information that I have provided by my medical provider?
Eining says our bodies are built to withstand 20 minutes of stress at a time.
And for the last 18 months, a lot of us have experienced stress longer than 20 minutes. And so what our nervous system does is adapt to that experience of stress. So it starts to release increased cortisol, increased epinephrine, which is adrenaline, into our system, and we might be experiencing difficulties with sleep, difficulties with exhaustion, maybe at times we feel like difficulties with our breathing. So we might be experiencing stress on all different levels.
Accessing concrete supports like friends and family, your medical provider, or a therapist or counselor can help cope with stress, but there are still other things you can do on your own as well, such as breathing and exercise.
Deep breathing and mindfulness is a wonderful support for that. Oxygen is the number one thing that increases the concept to my brain and my nervous system that I'm safe and okay. So can I kind of slow down and take those deep breaths and increase that oxygen level?